Hi everyone, we're group 16 and our scenario is called the distrustful second opinion seeker. The patient is midway through a treatment plan that was started by another student. Today's appointment is for a restorative procedure, a filling on tooth number 13. Recently, the patient saw another dentist who said the filling wasn't needed. Because of a previous negative dental experience, they have become skeptical and are questioning whether this treatment is truly necessary. Our goal is to demonstrate how the dental team can listen without judgment, clarify diagnostic evidence, reinforce transparency, and build mutual trust and resolution with the patient.
Hi, Ms. Taylor. It's nice to see you again. How have you been since your last appointment?
I've been okay, but I need to be honest. I went to another dentist for a second opinion, and they told me I actually don't need this filling. Are you sure you're just not trying to do extra work?
Well, thank you for sharing that with me. And I really appreciate your honesty. Sounds like you're conflicted after hearing two different opinions. Could you tell me a little bit more about what the other dentist said?
They said that the cavity was small, but it could just be monitored. I don't have any pain right now, so I'm confused about what's right.
I understand completely. It can be stressful when you're hearing conflicting information about your health, especially when you've had a negative experience before. Thank you for letting me know how you feel. So, just to make sure I'm understanding correctly, you're not feeling any pain right now, and because another dentist said that we might not need treatment, you want reassurance that we're recommending this for the right reasons. Did I get that right?
Yeah, exactly. I just want to be sure this is something I really need, and that I can trust what's being recommended.
That makes total sense. Dental treatment can feel overwhelming when different providers say different things. You're doing the right thing by asking questions. You deserve clear, transparent information about your care. So when we first started your treatment plan, you shared two goals with us. First, you wanted to prevent small problems before they became painful or expensive ones. And second, you wanted to avoid any unnecessary treatment and make sure you always understand what's being done. So today, this filling is part of that preventative plan. But it's also important to us that it aligns with your comfort level and your understanding.
Yes, those were my goals. I just don't want to go through something I don't really need.
That's completely understandable. So let's take some time to review the evidence together so you can make an informed decision. So here's your x-ray from that appointment. See that darker shadow between 13 and 14? That's the start of decay forming between the teeth. Even though it doesn't hurt yet, that area can progress under the enamel and dentin, causing a bigger problem in the future.
Oh, I see that dark spot. But how do I know it's really decay?
Well, that's a great question. That dark area shows a loss of mineral density. It's how decay looks like on a radiograph. To be transparent, we can also take an intraoral photo so you can see the darkening of the area before we do anything. Would you like that?
Yes, please. I'd like to see it for myself.
And similarly, we can show you a healthy area for comparison so you can see the difference. Once you've seen it, we can then discuss two realistic options. Proceeding with the filling now while it's small, which might be the most conservative treatment, or we can monitor the area with regular x-rays and fluoride varnish, knowing that there's a small risk it could worsen over time. Either way is your choice.
That actually helps a lot. I didn't realize cavities could get worse without pain.
Yes, pain doesn't often appear because decay is close to the nerve. Treating early helps avoid larger procedures later, like root canals or crowns, but ultimately the decision is yours. Our goal is to give you all the information so you can make the choice that feels right for you.
I appreciate that. After seeing the x-ray and understanding the options, I think I'd rather get the filling done today while it's still small.
That sounds like a great plan. Thank you for discussing it openly with us. I'll make sure you're comfortable throughout the procedure. And if you have any questions, please stop me anytime.
Thank you for explaining everything so clearly. I feel a lot more confident now.
We're really glad to hear that. We always want you to feel informed and supported.
In this scenario, the dental team demonstrated active listening without judgment, summarized and confirmed understanding of the patient's concerns, linked the conversation to previously established treatment goals, and used collaborative problem solving to reach mutual resolution.
By acknowledging the patient's feelings, showing diagnostic evidence, and offering choices, we maintain transparency and build trust. This approach helps prevent conflict, support patient autonomy, and strengthens long-term rapport in clinical care.
As the patient, I felt heard, respected, and incorporated in my treatment plan.
This concludes our role play for managing conflicts, the distrustful second opinion seeker.